Okay, hi Deepak.
Okay. Hi, Uttam. How are you?
Hi. We have been saying hi to each other for last 10, 15 minutes. We have tried multiple attempts to record it, but because of the
Tech-
connectivity, and now
Technology seems to not be favoring us.
I'm seeing you at the heart of the operation theater. I can see the background. There
Yeah,
is a nursing staff
work going
behind
on.
you,
Yeah,
and
yeah,
there is the operation theater.
yeah,
But okay.
yeah.
So,
It's the right ambience, I think. Yeah.
yeah, it's gone again. The connectivity is
No,
this
it's
thing.
showing up.
Okay. We will record it and we'll see
Yeah,
how it
yeah,
comes.
yeah,
Okay.
yeah.
So we know each other as alumni from BJ Medical College. I know you.
Yeah,
You have been practicing neurosurgery for last so many years.
yeah,
But more importantly, the reason I wanted to have a chat with you is your
yeah.
other facets. You're
Okay.
an accomplished author. I have read your articles and they're just fantastic. And especially your interest in technical matter, which as a doctor, very few people have got interest in technical physical matter. And
Okay.
more importantly, your interest in philosophy, the
Okay.
spirituality, and all those things.
Okay.
So, what I thought that rather than having a clinical chat, I would like to have a chat, and I want you to share your experiences
Yeah, yeah.
about in clinical practice about the supernatural things, spiritual things, or just things that ordinary mortals don't experience, but you have perceived it, you have analyzed it.
Yeah, yeah.
So I want to start with something your personal experience, that your clinical experience, either you as a neurosurgeon or you have
Yeah.
seen among patients, that those who have or have had different approach to physical ailments,
Yeah.
they responded differently, either positively or negatively. So do you recollect any of your patient that you have had some different experience?
Okay, okay. Yeah, I think Uttam, I get where you're coming from actually. I'd like to, if with your permission, like digress a bit in this, but
Yeah,
I'd like
yeah.
to make make one point to that somehow it's very unfortunate that people who are from a scientific bent of mind like us tend to believe into the metaphysical or the spiritual or the philosophical or something that is probably, I would say, even spiritual, only if something that is unexpected by science happens and that remains testimony to something spiritual. You get what I'm saying?
Yeah. And it is
Be-
very important for the viewers
yeah,
to understand.
yeah, yeah. So, which means that typically, if you go to look at it from a layman's perspective, you see a Baba who's generating some vibhuti from the atmosphere, and so he's defying the laws of physics. So, something that does not fit into the domains of science and which can't be explained by science is attributed to be either spiritual, metaphysical, or something which is quite interestingly, God has always been defined by one very beautiful definition of God is gaps in the knowledge of man are called as God.
All right, beautiful. Yeah.
So, so if I can't figure out something and if I can't find my science can't give me an explanation to this, then I attribute that to God. But if you yourself being a very reputed surgeon and I hold you in very high esteem because you are one of those guys whom we look forward to in when we were in uh,
Yeah.
uh, when I was doing surgery because your wife was actually my super senior in surgery. So you would be standing testimony to this that the human body itself, I mean, the way it functions, the way the whole our conglomeration of so many organs together working in sync itself is a miracle, and which by itself, I think, if it even stop to even understand that, to give you a modern day example, that a kidney, which when we talk of, we're still depending on renal transplants. So, an organ which is like barely the size of a fist or even smaller than that, and can singularly conduct the metabolism of the entire human body, which cannot be replicated. It can be done by a huge machine outside, but you can't find a mechanical kidney that can be implanted in the human body. So by that itself, I think there is something which could point to the existence of something which is more divine and something which is beyond the scope of intellect. So that is what that is what my understanding is. But coming to the main point that you had raised, yeah, there are you yourself in your long glorious career must have also encountered situations where the predictable, basically science is all about predictability, and when that predictability is not the trajectory of events does not follow the predictable path, then we start talking of looking at it as either from a metaphysical aspect. So there have been instances where we have kind of written off a case that the guy is not I don't think the guy's going to pull along for more than a couple of weeks, particularly like some glioma, grade 3. And for some strange reason, he comes following up with you for like,
Sorry, Deepak, for those non-clinical people,
yeah,
can you
yeah,
explain what glioma and grade 3, how serious the
yeah,
problem is? So it's
yeah,
a
yeah,
malignant
yeah.
brain tumor. Am I right?
Yeah, yeah, that's right.
Yeah.
That's right. I'm sorry, I'm
And
using a bit technical term, but gliomas are a family of tumors which arise from the connective tissue in the brain, and they are they are rather they are very recalcitrant and refractory to treatment. So even if we excise the tumor, they tend to recur, and the overall survival is not very positive. So typically, a grade 3 glioma, the 5-year life expectancy would be just around under 30% or so. So we do get surprises like this where we've operated and the patient is following with us up for a rather unexpectedly long period of time. Those kind of experiences we all do get. But my basic contention here is that I really don't want to depend on something that can pull its tongue out and I look at science and say that, look, I'm doing something way beyond what you're predicting. And that is the evidence of anything metaphysical or spiritual. So that's something which I would, I contest. I'm not very much on agreeable with that, So, but surely,
sorry,
I
could
mean,
you explain that? Could you explain that? Could you elaborate more on that?
in the sense that, okay, if you look at, uh, let's look down look upon this as religion and then spirituality because they are connected to one another. A large portion of religion, if you see that we follow, I mean 98% are, if you see, they are faith based. It's a faith based approach which depends on some kind of a extraneous deity or a force or some kind of a prophet or someone who will come to you in times of your need. So it is actually a very self-centered, selfish approach to looking at God or any such entity.
Energy.
Yeah,
Yeah.
energy, but which is primarily focused at trying to, where you can fall back on when you, in times of need or whatever. So that is actually I would say, a very selfish connotation of religion, and which is perfectly fine. I mean, we all need it. I mean, as surgeons, also, I pray to some entity when I'm doing some critical surgery. So there's nothing wrong with that. But the crux of spirituality, as we understand it from the Indian context or the Indian knowledge systems, is something far beyond that. Because there it is not just about, like in Marathi, they say that Sankat Vimochan is to get rid of your problems. So the crux of spirituality from the Indian context is actually to find out the basis of what is my true self, which is called as koham, which is what is my true nature. And that, I think, makes a lot of sense because I have spent a lot of time. In fact, I had the privilege of even visiting the underground tunnel in CERN for where they have these where the Higgs boson was discovered actually, and the strides that humans have made in the domain of trying to make sense of the objective universe is humongous. I mean, it's beyond anyone's capacity. That CERN Large Hadron Collider is the largest man-made machine in the world. It's humongous. It's huge, and they're trying to find out the how did the universe come into existence. But I have to, after having followed up that, I mean, I've tried to study quantum physics at length, trying to understand, like there's a standard model of physics which says that the force and matter, and trying, that's called typically the reductionist approach to solving the problem. So if I understand what is atom made up of, I break it into further, they're quarks. Then there are, so broadly, all the universe is divided into fermions and bosons. Fermions are the ones which are actually the matter, and bosons are the force carrying particles. So these are the very broad categorization of the universe.
Sorry, Deepak. It is going far. I was
No, I'm just trying to
way
explain it
more.
to you
Yeah,
in a very
can you
yeah,
simplify? Can you
yeah,
simplify
yeah.
the matter, please?
I'll tell you. The objective universe that we see is made up of two things. One is matter, and the other is the force, like gravity or electromagnetic force. So the standard model of physics says that matter is made up of what are called as fermions, named after Enrico Fermi, and so those are made of leptons and quarks. So basically, that is one, you can say, category which forms the matter of the universe. And there's another what are called as massless particles, which are named after Satyendranath Bose. They're called as bosons. Those are massless particles, and they are the ones which mediate all the forces: the electromagnetic force, the gravitational force, the strong internuclear force, and the weak internuclear force. What I'm not trying to get too technical. I'm just trying to tell you that we are trying to understand the objective universe. So we are saying, okay, this is the force, this is the matter, and that's the whole effort is into trying to analyze this further and further. So now they are actually smashing protons into one another and getting a absolutely they call that as a shower of subatomic particles, which are very difficult to trace because their half lives are into pico milli nanoseconds, so you can't even spot them. But I'm telling you this background of all this only because I've realized that I will never be able to understand the objective universe. It is beyond my sense organs because it is too complex. There are too many unanswered questions. So which gets to the point of the Indian knowledge system, which says that then who is the one who is seeking these answers? And if I understand who is seeking the answers, that is the answer to Koham. Who is the seeker? And if I get that answer to who am I, then I don't need to find answers to making sense of the objective universe. So the entire focus of the Indian knowledge systems is more inwards rather than the scientific endeavors of the Western world, which is outward. They're trying to make sense of the universe. They're going on and on and on. But I'm very, very convinced about one thing, that even if you can eventually come to the point of saying that, okay, I have found out that, let's say, the string theory is what is the ultimate truth. But then who was the engineer and who was the brain behind coming up with the string theory and manufacturing of the whole universe? It doesn't make sense. 14 billion
Okay.
light years is something which is the vastness of the universe, and to believe that there's a creator is something that does not that beats logic, So coming to the whole issue, the whole center, the theme of what I would recommend to people who are pursuing this or who are seekers is to go inwards, and the Indian knowledge systems which try to make sense of finding out who am I, Koham, that is what eventually will lead me to the truth. That is what I wanted to share.
Okay. Now, thanks for elaborating and giving the background. But the more crux and the viewers would be interested in knowing
Yeah,
how this, you as a doctor, as a neurosurgeon, and your interest in physics, metaphysics, and your interest in philosophy and
yeah,
spirituality,
yeah,
how does it actually has affected you on the ground? I mean, what have you seen in patients or what you have
yeah,
experienced
yeah,
whenever you have given care to your patients when you're operating, you have
yeah.
seen clinical situations and there may be something, some kind of unfortunate sort of not uh, positive outcomes with the
Yes,
patient.
yes, 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 yes,
How
yes.
you have dealt with those in
Yeah,
your
yeah,
practice, in your
yeah.
career, in your profession?
Yeah, yeah, yeah. I would like to answer this question by first of all acknowledging the stellar work that you're doing towards understanding the temperament and developing workshop for surgeons and all. And it's really something which is
Mm.
uh, very, very commendable work you're doing.
Thank
Uttam,
you.
I really appreciate it very much because there are very few people who think on those terms. But coming back to your question, I'll give you a very beautiful example. As a surgeon, we are faced with a very like I believe that neurosurgery is a schizophrenic specialty. You might laugh at that, but it's schizophrenic because uh, at one end I have to be very gentle with the organ that I am working on. I have to be very gentle when I'm dissecting the arachnoid, when I'm dissecting the blood vessel, when I'm doing aneurysms. It has to be very, very gentle. And when I'm on the tumor, I have to be extremely aggressive to make sure that I remove that entire tumor, which is causing havoc for the patient. Yeah. So it's a combination of, you know, I'm a split personality. At sometimes I have to be extremely gentle, and the other times I've got to be really hard and be very sometimes really push myself. This is a Because of this duality in the approach that is required. I've seen people veering towards either side. Some are either excessively gentle and they tend to be a little more conservative, and others are a little more aggressive and they tend to cause more complications, perhaps. I mean, from whatever limited things that I've seen. So you've got to walk that razor thin edge. Okay. Now, how can you eliminate this tendency to veer to either side? So, for that, one of the very beautiful concepts in our Indian knowledge system, which comes to my assistance, is that one is I, I do not participate in the surgery per se. I am an observer. Now, that is really hard to understand because, see, at one end, I'm saying that I'm doing the surgery because it's my hand. Deepak Ranade is doing the surgery, but there is an observer who is observing Deepak Ranade also. Okay, because so I can judge my own self, like you can be your own devil's advocate because every
Yeah.
step I'm taking, if that observer is making a judgment and telling me that, Deepak, I think you need to go a little slower. Okay. Now, having that observer, and we all have it, it's just that people who are overconfident tend to just silence that completely, and they just say that, no, no, I know better, just shut up. But so that is one thing, that you have to keep that one observer and listen to that observer. And 99% of the time, that observer is right here. That it will give you a very, I would say, unbiased and very impartial assessment of the situation. Because if I'm Deepak Ranade, I remain only Deepak Ranade and I don't split myself into an observer and Deepak Ranade, then I'm into trouble, because then I am entirely at the sole discretion of my limitations or my abilities. But when the observer is also coupled with my performance, then it is going to make an independent assessment of what I'm doing. That's one. And the second important thing that works for me when I'm doing surgeries and even dealing with, like your question was about facing unexpected or unpleasant outcomes, is right at the beginning, at the outset, I make it very clear to the patient that, look, I'm going to try my best. There are, at the end of the day, I'm as much as made up of the same flesh and bones as you are. I have, my intentions are very honorable. I'm not being guided only by pecuniary or financial considerations when I'm doing this surgery. And at the end of the day, I do believe in that some whatever power you might call it, and I treat myself as just an instrument of being that power which is there. So I am as much an instrument as the scalpel. I'm not the end all and be all of everything. So if I can view myself as being just an instrument and a part of the whole scheme of things, then I think it makes things a little easier, and it also helps to cut down your ego. Sorry, it was a very long answer. Yeah.
No, that's fine. Now, whatever you have said, I will give some commentary from cognitive psychology perspective.
Okay. Okay.
First,
That's
on a
interesting.
lighter note,
Yeah.
I think the analogy that you gave is
Yeah.
it is like a schizophrenia.
Yeah.
I can confirm that, yes. And as a schizophrenia, you are having hallucinations as well. You just get, and this is on of course, on a lighter note, but what you have, give me a second. Sorry.
Yeah.
So what I was saying is that the comparison analogy you made was as a speciality like a schizophrenics.
Yeah. Yeah.
What you described,
Yeah.
the duality of the thoughts.
Yeah.
And that is the other thought is called as metacognitive process.
Yes. Yes. Yes.
And I will, yeah, and it is an indicator or it is a sign of a expertise.
Okay. Okay.
Metacognition is thinking about thinking. So whatever you are acting,
Yeah.
it is like a boss. I mean, the in a very casual way, the metacognition can be described as whatever we think, it is like
Yeah.
a clerk.
Okay.
But metacognition is like a boss. Clerk is making kind of acting on boss's instruction.
Yes. Yes. Yes.
And metacognition is directing that clerk to do the regular kind of whatever the bureaucratic thing.
Oh, yes.
So when you say, what you beautifully describe is that you are not the one who's doing it. It is the metacognition you are aware, although you don't, I mean, you didn't use this terminology, but
Yes.
that
Yes.
is the
Yes.
perfect. And this is a kind of the metacognition, and there is an insight as well.
I think you mentioned about this in your book.
That's right. That's right.
Yeah,
That's
I
right.
read your
That
book.
is,
Yeah,
that
and
is, that.
I kind of now I kind of resonate with what you're saying, because I remember
Yes,
reading
yes,
about it.
yes,
Yeah.
yes. And when the clerk feels that I'm the boss, that causes the problem.
Problem. Absolutely. You said
The
it.
clerk doesn't listen to the boss. The clerk doesn't ask. I mean, those who are overconfident,
Yes.
the clerk think that they are the boss, that they have got all the things.
Absolutely.
So there need to be
Absolutely.
whenever as you know, we always say that I mean, the decision of doing surgery is not that difficult. Deciding not to do surgery is the most
Yeah.
difficult one.
Exactly.
And that is taken by the metacognitive, that is taken by the boss. The clerk can't decide. So that is one thing. Secondly, it is the same process when you say that it is the humility, the humbleness that I'm
Yeah.
just a scalpel. So that shows the limitation of you have, and that saves you from becoming overwhelmed by the responsibility, and that
Absolutely.
shields you from the stress of the surgery. So
Absolutely.
you're
Absolutely.
it is, and it has come out of the experience. The initial, when we all start practice, we're enthusiastic, we do things that are above our limit.
Yeah.
But then with experience, those who understand this metacognitive process, the other day
Yeah.
we were talking, you shared an experience that when you're operating, you experience that it is not me who is doing the procedure. It is I've
Yeah.
been drawn into. Again, we will discuss that in detail sometimes, but that again, it is the state of flow that
Absolutely.
again expert people and you might be experiencing. So in this last 5 minutes, you
Yeah.
have demonstrated the habits of your expertise or how you have developed the expertise in neurosurgery. And although you didn't use the technical terms, what you described is the neurosurgical expertise that you have. It was wonderful, and I'm sure that I personally would like to have more chats with you in future.
Oh,
But
yes. Oh, yes.
I think we will. We will conclude our session today. But I'm sure
Okay. Yeah,
that we would have more opportunity to delve and go deeper about it
Oh,
and
yes.
share
Oh, yes.
your personal experience.
Oh, yes.
So
Oh,
thank
yes.
you very
Most
much,
certainly.
and it was the apt timing and the apt location as well.
Oh, yes. Yes.
Okay.
Thank you so much, Purushottam. Thank you.